Why do the feet swell before death? Subtle warnings you shouldn't ignore. It's one of the most quietly troubling things families notice in their loved ones near the end of life. Swollen feet and ankles. And for many, it raises the same quiet question. Is this a warning sign? Does this mean the end is near? Today, we're going to talk about it openly, with compassion and understanding. In this video, you'll learn why feet often swell before death, what the body is trying to communicate, and most importantly, how to respond with knowledge and care. This isn't about fear. It's about clarity, peace, and dignity. What is foot swelling, and why it happens in old age? First, let's understand what's actually happening when feet or ankles swell. This condition is called peripheral edema. It occurs when fluid builds up in the lower parts of the body, usually the feet, ankles, and sometimes the legs. For older adults, this is common, but when it becomes more pronounced in the final months of life, it can signal underlying changes in the body's vital systems. In healthy adults, the heart pumps blood efficiently, and the kidneys filter excess fluid. But when these organs begin to slow down, whether due to age, illness, or terminal conditions, fluid starts to collect in the extremities. Gravity naturally pulls this excess fluid downward, making the feet the first place we see it. 1. Slowing heart function. One of the most common causes of end-of-life foot swelling is a weakened heart. When the heart can't pump effectively, blood starts pooling in the legs and feet. This is often seen in elderly people with congestive heart failure or other cardiac conditions. As the heart weakens further, fluid leaks from the blood vessels into nearby tissues, causing puffiness, tightness in the skin, and sometimes discomfort when walking or wearing shoes. This is the body's way of signaling that the circulatory system is under serious strain. While it's not always a sign of imminent death, it is a warning that the body is slowing down. Sign 2. Kidney or liver decline. Another major contributor to foot swelling near the end of life is declining kidney or liver function. The kidneys are responsible for flushing out extra fluid. When they stop working properly, water and sodium are retained, leading to swelling. The liver too helps regulate fluid balance. When it's failing, a condition called hypoalbuminemia can occur. This reduces the body's ability to hold fluid in the blood vessels. The result? Fluid escapes into soft tissues, especially in the lower limbs. This kind of swelling tends to worsen late in the day, or after sitting or standing for long periods. If you notice this happening, gently elevate the legs when possible and consult a medical professional for assessment. Sign number 3. Reduced mobility and circulation. In the final year, or even months of life, elderly individuals may spend more time in bed or sitting. This inactivity slows circulation, and when blood doesn't move efficiently, it causes pressure to build up in the veins of the legs. This pressure forces fluid out into the surrounding tissue, leading to visible swelling. You might notice this especially in those who are no longer walking or who are mostly bedbound. Again, it's not the swelling itself that signals death, it's what the swelling represents. A body beginning to wind down. These physical signs are quiet, but they speak volumes. They're not meant to frighten you. They're meant to help you recognize when it's time to shift from fighting illness to providing comfort, care, and peace. We'll explore the emotional and caregiving responses to foot swelling before death, including what foods and fluids to focus on, how to manage symptoms, and when to call for professional support. Now let's talk about the most important part. How do you respond with care, dignity, and love when these signs appear? What can you actually do when swelling starts to occur? Step 1. Focus on comfort over cure. When a senior is in their final stages of life, our role as caregivers and loved ones gently shifts. It's no longer just about fixing symptoms, it's about relieving discomfort, and bringing peace. Swollen feet can cause tightness, heaviness, and restlessness. But the goal isn't to eliminate the swelling entirely, it's to help them feel at ease. Here's what can help. Gently elevate the feet with a soft pillow to help reduce pressure. Use loose-fitting socks or shoes, or go barefoot if it's safe. Offer light leg massages with doctor-approved oils to promote circulation and relaxation. Step 2. Support with gentle nutrition and fluids. In this stage of life, appetite often fades, but that doesn't mean nutrition stops being important. The key is choosing small, nourishing, and hydrating options that support the body gently without causing fluid overload. Here are a few caregiver-approved ideas. Warm broths or light soups that hydrate without overwhelming the kidneys. Watermelon, cucumber, and fruits with high water content, offered in small bites. Electrolyte-balanced drinks with medical guidance to prevent dehydration while managing fluid retention. Avoid salty or processed foods, which can worsen swelling. Think simple, natural, and comforting. Step 3. Watch for skincare needs. Swelling can cause the skin on the feet and ankles to become tight, shiny, and fragile. In some cases, it can lead to wanting cracks, bruises, or pressure sores. Especially if the person is less mobile. Caregivers should keep the skin moisturized with gentle fragrance-free lotion. Check daily for kink and redness, blisters, or open areas. Reposition the legs and feet every couple of hours if the person is bedridden. This not only prevents complications, it's also an act of gentle care that reminds your loved one, you are still seen, you are still cherished. Step 4. Know when to call for support. If swelling becomes sudden, painful, or is paired with shortness of breath, confusion, or chest discomfort, it's time to speak with a doctor or hospice nurse immediately. These may be signs of a larger issue, like heart failure or fluid around the lungs. But if swelling is slow and painless, and your loved one is already in hospice or palliative care, it may simply be part of the body's natural winding down. This is when your presence becomes the medicine. A hand held, a song played, a quiet "I love you" whispered in peace. Final reflection. A sign of transition, not just decline. Narrator, gentle reflective tone. Swollen feet are not just a physical change, they're often a quiet symbol of transition, a signal that the body is beginning to be let go, step by step. It may be heartbreaking to watch, but it's also sacred. Because in this phase, every soft blanket, every sip of water, every quiet moment shared is a gift. A way of saying, you're not alone, I'm walking beside you, all the way home. If this video brought you clarity, strength, or comfort during a difficult time, please consider giving it a like so others can find it too. Share it with someone who's caring for an aging parent, grandparent, or partner. And don't forget to subscribe for more trusted senior wellness guidance delivered with compassion.